For centuries, giving birth was potentially deadly for mothers and their babies. But over the last 25 years of global efforts, that changed. Maternal mortality plunged by 40%. We were on track to stop preventable deaths in childbirth.
I don't know what's going on.
Until now.
What's the doctor what happened?
The mother is...
Nigeria has had the highest maternal mortality rates in the world for years. It has repeatedly been labelled the worst place on earth to give birth. So today I'm joining healthcare worker Atinyada in her rounds of clinics in the north of the country to find out why.
One, we have lack of electricity power, and sometimes they will just bring it for 30 minutes to 1 hour. The second challenge is the essential drugs. We don't have the drugs.
This struggling primary health clinic is the first and often only port of call for pregnant mothers. In the waiting room, they share their stories. Nearly all of them, like Blessing, have lost friends and family to childbirth. All of them have nearly died themselves.
Always told me, especially here, down here is paining me.
Blessing gave birth just a few months ago.
It was not easy for me, man. So I was very scared. I have a seizure, as in all my body is shaking. To the extent I even collapsed. And they said that they will operate me. And I started crying because I know my husband cannot afford the money. My husband started calling his relative to help him for financial support. I nearly died.
Pregnant with twins, Blessing was malnourished and showing all the signs of deadly preeclampsia. But the hospital bills were the equivalent of 2 years' salary. Friends and family frantically crowdsourced the funds, terrified she might die like her sister did.
She was in labor for 4 days. To the extent she gave birth, no strength on her body. She did not make it, even her baby did not make it. So that is my fear. I was praying, God, don't allow this such to happen to me again.
Why didn't she go to hospital?
I think it's the same financial support. I was afraid so that the same thing will not happen to me. You know, when death comes, there is nothing else you can do about it. You cry, later you have to calm down because you cannot challenge God.
Aside from financial concerns, women in Nigeria struggle to access hospitals. And even when they get there, there's no guarantee there will be the resources or medics to help. In Nigeria, on average, there's only one doctor to nearly 10,000 patients.
Sai dai yan anguwa, low BP ne take fama da shi. To kamin ta je asibiti kuma a gida sai ta faɗi ta rasu. An kira mijin kamin iso da mota ta rasu kuma asibitin da ɗan nisa, ni tana cikin anguwa haka ne.
Tuna haukai wani gaskiya babu ga likitoci amma ba su da kayan aiki. Wani kuma gashi nan akwai kayan aikin babu likitoci tsaye.
The fear is these conditions will only get worse amid unprecedented aid cuts from the US, the UK and other countries over the last year.
I fear maternal mortality, it will be high, and with the children mortality, it will increase because of the support that we are not getting.
With Let's Go, we still have few drugs that we still can manage and give people. So let's say in the next 1 year, everything will be stocked out. And so we're left with nothing. And so the support that we can still offer now would be no more.
So you just have 1 year left?
It will not reach 1 year. Everything in the store will finish.
Across town, in another clinic, all of these issues are causing a different kind of grief. Hawa, who is pregnant with her 13th child, has lost 7 babies in childbirth.
Akwai zafi sosai. To in na ƙara yin wani ciki kuma na san tun a cikin ma sai na tunanin ba zai zauna ba. Sai in shiga damuwa sosai. Haka dai har in zo in aihu.
Asina just lost her baby a few days ago, the 3rd to die in childbirth.
An doki sabon za ka kara ni kamun yaro ya samu ya fita ya girma. Ni yaro ya girma kin san damu da ciyace ne za a yi. So sai sun je sun bar ni sun je sun zanna. Ya zo ya fita bare. Gaskiya na ji zafi don me yasa in na zo zan yi wanka ruwan zafi na zan sha ruwan zafi. Zan shiga kin ga ba yaro akwai zafi. Na da rarrabe sosai. Dole wani abu ya faru da kai dole sai ka dangana ga Allah. Dole kuma sai ka yi hakuri. Wannan jaraba ne daga wurin Ubangiji.
And this is all compounded by conflict.
To, da na aifu wata rana muna cikin barci sai Boko Haram su zo.
Since 2014, Nigerian security forces have been fighting Boko Haram and other militant groups.
Mu gudu daji, Boko Haram su zo mu gudu daji. Sun kashe mutane ma kusa da mu.
While hiding from Boko Haram, Dorcas's newborn fell ill.
To ba inda zan kai yaro, kawai dai muna dan shashafa ma da yin gargajiya kai. Sai Allah ya karbi hannunsa.
Today, we met just a handful of women, and among them, 15 babies had died, and at least 2 to 3 of their siblings had died in childbirth. And that's just a tiny, tiny portion of people in 2 clinics. And that just shows you the extent of the problem here. And it's only going to get worse.
The biggest challenge was the loss of foreign funding Nigeria relied on following Donald Trump's decision to gut USAID last year. Hundreds of projects had to close, impacting millions of people.
The cessation of the US funding was so abrupt, short notice, there was no adequate window for transition. The scale is huge, enormous.
Donald Trump made it very clear that it wasn't his responsibility to fund global health. What would you say to that comment, that Nigeria should be dealing with this, not any other country?
If we don't address this problem here, it may spill over to other places and it contributes to global burden. And our conscience will never be clear. The fact that there's a problem anywhere, it should be a concern for everybody, everywhere.
Nigeria is just one example. This is playing out across the world, according to the United Nations. And while there are no concrete numbers yet, preliminary data is showing a rise in maternal mortality globally.
In 19 countries where we work, already 11 million people lost access to sexual reproductive health and to gender violence services.
What does that mean for the babies that are being born?
When services get shut down, when maternity wards close, the maternal mortality rate rises. It's as simple as that. This will mean that they will have no skilled birth attendants. They will have no access to medicines that can help them survive childbirth. It's not fate, it's not biology. Women die when funding is cut, when services get shut down.
There were entire healthcare systems that were propped up by USAID. Obviously, that's not a great plan.
No.
Is that a mistake that the world made to rely too heavily on foreign funding? And are you seeing a shift away from that kind of model?
Slowly but steadily, some countries were really making strong investments in their own national health systems. Just the scale and the abruptness of the cuts, it was just too much, too quick. We know what works to save women and girls. We know what works to build resilient health systems. So my appeal would be invest in innovative solutions. At this point, we are just afraid that we won't have funds that allow us to continue that work.
And this is only going to get worse. Right now, the world is grappling with the highest level of armed conflict since the Second World War.
This is like the perfect storm gathering. We have health systems that are stretched to the limit with less funding coming. It's a very dire scenario for the next couple of years.
That perfect storm is brewing in the Central African Republic.
Good morning, ladies and gentlemen. A very warm welcome to Barrow.
This is Barrow, a town on the country's northern border with Sudan. We've come here with the UN. The situation is so tense that we're accompanied by armed escorts and have to stay on a UN base. This country already had one of the highest maternal mortality rates in the world and was dealing with its own internal conflict when war erupted in neighbouring Sudan in 2023. In the only hospital just a few kilometres from the fighting, medics are overwhelmed by the influx of refugees. Amna, a Sudanese refugee, was rushed to this clinic a few hours ago. She has just lost her baby at 9 months and nearly bled to death herself.
Ce matin, elle est venue, elle est malade, on a eu le palu, il y a eu l'infection et puis l'enfant est venu par siège. Il est mort-né du coup? Ah oui, parce que la grossesse n'est pas suivie.
This is a recurring problem. Heavily pregnant refugees arrive when it's too late.
Rendez-vous ne viennent même pas à la consultation, parfois même pas une fois.
Even if they can make it here, the hospital chief says they can barely cope. Outside the wards, families are camping whilst they wait for treatment. This is because the entire hospital only has 60 beds for a local and refugee population of nearly 40,000 people.
Dans cette ville, on n'a qu'une structure sanitaire. Pas plus de 20 km, vous n'en avez pas trouvé. Comme il y a eu réduction d'emblée, la prise en charge revient à chaque famille. Et pour chaque famille qui n'ont pas de moyens, vous allez voir que cette dame ne pouvait pas venir à l'hôpital. J'ai d'accoucher à la maison. Et quand elle va accoucher à la maison, le risque de décès de l'enfant, y compris le décès maternel, va augmenter. Vous allez rendre compte que maintenant, c'est seulement que le nombre de décès maternels va augmenter, le nombre de décès des enfants va augmenter, et ça sera pénible, non seulement pour la ville de Barrow, mais c'est pour le pays.
Aid cuts have meant they've lost multiple members of staff. All the midwives were let go, piling pressure on Delphine, who's just an assistant, but now managing all the consultations alone.
Un problème, si un pays est en conflit, le retombé, c'est ce qu'on va vivre. Et s'il y a problème maintenant, on n'a pas la capacité de gérer.
Amna and her niece Radia fled slaughter in Darfur on foot last year. Radia thinks if there were better resources, Amna's baby might have lived.
أول دايتهم كتار واسمين ده داية هسهم باقيهم نقصهم مازين أول هم دايتنا كتار لكن هسه نقصهم فهم كتار كانوا كدجانا دمان ده
كاتي جمامك علي اسمع أمي.
At Barrow's refugee camp, the UN had set up mobile maternity clinics to manage the sudden influx of refugees. But they were dismantled when the funding was cut. Marie Justine, who works for UNFPA, takes us around what is now just piles of rubble.
Les sages-femmes travaillaient en clinique mobile sur le site ici. Donc elles venaient ici et faisaient les consultations prénatales, elles faisaient également les consultations postnatales, elles faisaient des accouchements ici. La fermeture de site ici. Et pour moi également, c'est de l'amertume de voir que les femmes courent le risque en voulant donner la vie. Ça fait mal au cœur. Ça fait mal au cœur parce que quand je suis arrivée, les femmes se sont rapprochées de moi. Elles pensaient que je venais pour pouvoir remettre en place le service.
Without these mobile and temporary centres, women are dying on their way to hospital. Basaina and her family fled Darfur 3 years ago on donkeys. Armed groups intercepted them on the way, attempted to rape the woman, and murdered Basaina's husband when he tried to intervene. Alone, she finally made her way to this camp.
والله تعب ده كيف راسي يعني مشاكل زيادة ده بس يعني والراجل مات وجينا في الشارع مواصلات دورنا في المستشفى هم قالوا مواصلات بالليل ده هم ما بيرفضوا من سيت هنا يودوا مستشفى يعني أثرت قلبي لما لحد وحصلت مستشفى هناك. بني خالتي وجاء من السودان ومشاكل عمل هناك في السودان خالي، وهناك عملية ما فيها، تو جاء في المستشفى عمل له عملية وما عنده الدم، طوال من عمل له عملية جنا يتوفى، وهو له عمل زي 3 يوم 4 يوم كده خلاص بكره يتوفى المرة دي. تو قروش ما عارفين يشتروا بدمه. حزن ما بوجعني في قلبي، أختي ما بوجعني في قلبي، يعني قاعد حزنان بس.
Bakita, who was 9 months pregnant, fled Sudan just a few months ago.
ما هنا مواصلات ما في بوديك بيها، وما عندك كمان عندك زول مسؤول منك هنا بوديك ده، وكم مشيت هنا قلت في الشاغل بشيل لك جينا منه بوديك المستشفى، عشان كده الناس خايفين، وهنا مواصلات ما في، وكم مشيت المستشفى ما بيستقبلوك أجلا.
It just feels like humanitarian crisis layered on humanitarian crisis here. Even before a war erupted just a few kilometres from where we are, the Central African Republic was struggling with some of the highest maternal mortality rates in the world. That's obviously only got worse. Humanitarians, nurses, doctors, refugees, everyone we've been speaking to today don't understand why, when at the moment where the need is increasing, the support and the funds are decreasing. And of course, at the sharp end of that, the people who are most impacted are the mothers and their babies.
The midwives who did run this maternity hospital are now jobless in the capital, Bangui, increasingly frustrated that they are not able to help. Clara worked as the chief midwife in Barao Hospital with Delphine until 2025, when Trump first announced the aid cuts. Since the Sudan war erupted a few years ago, the number of pregnant women needing their services in Barao more than tripled.
Avant, on consultait 50 à 60 femmes enceintes par jour, mais avec les réfugiés qui sont venus, on peut avoir plus de 150 à 200 femmes par jour à l'hôpital. Et ça fait qu'on a les ruptures des médicaments. Lorsqu'ils sont venus là, ils sont venus avec beaucoup de pathologies. Ça fait que les antibiothérapies, ça termine rapidement, les paludismes, et puis ça fait qu'il y a beaucoup de cas de mort-nés et de décès maternels. Et le cas de décès maternels, là, ça augmente par rapport aux réfugiés qui sont venus à l'hôpital de Birao.
She is speaking to us from the country's only children's hospital, which is also one of the best equipped health facilities. But even this centre is struggling.
Et donc c'est important qu'on puisse vraiment mettre en place des stratégies pour pouvoir améliorer tout ça. Mais là, il n'y a plus de financement depuis l'année surpassée. Et donc avec le peu qu'on a, on cible maintenant quels sont les enfants qui peuvent être pris en charge gratuitement. Et donc je peux vous assurer qu'il y aura des décès.
As we wait in the NICU, a baby is rushed in. The baby girl was born after a difficult labour in a poorly equipped clinic miles outside the city.
Il n'y avait pas l'ambulance. L'ambulance est venue ramener un autre enfant. Ils sont venus comme ça, soit en moto. On n'a pas réussi à les gagner.
The nurses and the doctors rushed to try and keep her alive, but she just died in front of us. She's been on this earth for just 2 hours.
C'est normal. Ça fait partie de notre quotidien.
Nous sommes arrivés à un stade où on ne doit plus retomber. Parce que si on retombe, ça sera plus catastrophique.
And the time to intervene is now, not later.
We've infused a lot of hope that finally the world would be on track to reach zero preventable maternal mortality. We know what works. They will not forgive us for having promised them a world with more dignity and now failing them.